Oh, welcome back. You're tuned into SA Today. More news at the SAWA. The World Health Organization has officially classified the Omicron variant as a variant of concern. Now, a number of countries around the world have decided to restrict travel to and from Southern Africa, where President Cyril Ramaphosa is, in fact, today convening a meeting of the National Coronavirus Council to discuss Omicron and the rising number of new infections, particularly in the Gauteng province. Well, to discuss this further, we're joined via Zoom by Professor Bruce Mellado, member of Gauteng's COVID-19 Advisory Committee. Prof, a very good afternoon to you. Thank you for joining us here today on SA Today.
Thanks for having me.
Prof Mellado, Gauteng accounts for at least 80% of all the cases. Are we officially in the fourth wave within this province?
As a committee, we sort of abstain from declaring a wave because there is a debate about what actually constitutes a wave. And we don't want to get into issues pertaining to discussions of such type. Now, what is clear, given the number of positives and other indicators, the acceleration, the way the numbers are going, it's evident that we're going towards a fourth wave and that a peak will actually take place. And that's what we're now calculating as we speak.
Prof, obviously we're looking at the models that you are implementing. I mean, which areas in Gauteng are currently your areas of concern?
So if you look at the geospatial distribution of the cases, it was evident that the first cases, the first surge occurred in Tshwane. But as of this week, about mid this week, we see that the numbers are increasing in other places such as Johannesburg. So it's not really the fact that we have certain areas of concern. It appears that the virus is moving around. Now, one has to take into account that we have the highest level of mobility in the province since the advent of the pandemic, which basically makes it very hard to contain in the current circumstances. So one can say that we have community transmission that is moving around and that is spreading across the province.
Prof, without preempting too much, could this new variant be driving infections, particularly in Gauteng as we speak? The results of the genomic analysis that were disclosed on Thursday indicate that the dominant composition, the dominant variant is the one that you just been mentioning and talked about, which appears to be significantly more transmissible than other variants. We can actually verify from the actual numbers and the acceleration with which we see the growth that indeed we're dealing with a more transmissible virus. And as a result of that, as it happened during the third wave, remember the Delta variant became dominant before we reached the peak of the third wave. We have to recalibrate the models to understand what's going to happen in view of the fact that the virus that we have now is more transmissible. Now, what is very, very important, and we need to be paying a lot of attention to, as many people are, is what is the rate of hospitalization and mortality and excess mortality that will emerge in the next few days too. Well, Prof, as we compare what happened, draw comparisons rather from the third, second and first wave, what exactly are we anticipating with this new variant?
So provided that we don't have a catastrophic outcome, in what sense that the vaccine doesn't work or we have a catastrophically high reinfection rate, which does not seem to be the case, because if that were the case, the numbers, especially of mortality and hospitalization, would be much larger. So we don't think that we have a catastrophic impact here. But because it's more transmissible, what happens is that the peak of the wave happens earlier. So we've run our first round of calculations with the limited data that we have and reported it yesterday to the Command Council. And it appears that at the pace we are going, we should be reaching a peak round about mid-December, end of the year in Gauteng. Now, that is not great news in the sense that that coincides with a period when people leave the province to other provinces. So, unfortunately, we expect the virus to spread correspondingly.
Well, Prof, you've spoken about the test positivity rate in the province and perhaps how it's driving average daily tests at large. I wonder how, what's emerging at this point, if you could divulge that for us. And then when we look at areas of concern, particularly as we roll out our vaccination drives, what more needs to be done on that front?
So, as you correctly pointed out already, the positivity rate has increased very fast. And when we see a rapid increases, not just of the number of positives, but also the positivity rate, we clearly become extremely concerned about the advent of Omicron. Now, what is evident and what we need to do is very clear. The advices haven't changed. Non-pharmaceutical interventions are extremely important, especially now that we deal with something more transmissible. But also, and I do agree with the sentiment that has been expressed by the Department of Health, it's very unlikely that the vaccine doesn't work. It's very likely that the efficacy of the vaccine will remain high for this new strain. And as a result of that, we continue to encourage everyone to get vaccinated as soon as possible.
All right, Professor Bruce Mellado, thank you very much for joining us, member of Gauteng's COVID-19 Advisory Committee, again chatting to us about the current situation regarding the Omicron variant. Variant of concern has been done by the World Health Organization, again, as a number of countries around the world have issued restrictions traveling to and from Southern Africa. We know that the president is, in fact, meeting with the National Coronavirus Command Council to discuss Omicron and the rising number of infections. Again, Prof. Bruce Mellado just chatting to us about the imminent situation in Gauteng as an economic hub and also perhaps as a point of concern, an area of concern, this as we try to understand the data, translate that data and see what's emerging, making imminent plans for what's to come should the fourth wave come into place. Let's take a quick ad break. We continue with more news on the other side. We'll be right back.
We could all use